Other environment news, the World Health Organization says more than 1 in 4 deaths of children under 5 years are attributable to unhealthy environments. Every year, environmental risks such as unsafe water and indoor and outdoor air pollution take the lives of 1.7 million children under 5 years. Joining us live via Skype from Geneva, Switzerland for more on the subject is Dr. Neira, Director of Public Health, Environment and Social Determinants of Health at the WHO. Dr. Neira, welcome to the show.
Thank you very much.
Could you give us a sense of the problem when it comes to pollution and its impact on children? What kind of sicknesses do we see children affected by?
The most important diseases are, if we are talking about air pollution, are pneumonia, for instance, all respiratory diseases. I'm sure that people realize that we have an increase of asthma cases, for instance, and obviously all the diseases related to diarrhea and water-related when we talk about lack of access to safe water. Clearly, the environment can be contributing enormously to our health, the health of our children. But today, unless we reduce the environmental risk factors to which the children are exposed, we will keep having 1.7 million deaths every year in children under 5, and those deaths can be avoided if we reduce those environmental risks.
So what are some of those risks, especially if we want to focus on sub-Saharan Africa?
Well, in sub-Saharan Africa, children are exposed to a double risk when it's about air pollution. They live in cities, and therefore they are exposed to the air pollution generated by cars, by industrial production, by waste incineration, by buildings, and the lack of sources of clean energy. But in addition to that, which is affecting children in the developed world as well, in addition to that, in sub-Saharan, the children are living in places where in most of those places, they don't have, for the household use, they don't have clean fuels. So they are still using wood or very polluted fuels to cook or to heat in the house. And that is generating smoke that is going into your lungs and is going into your brain. And this is really very dangerous for the health of the children. In addition to that, in addition to the diseases like asthma or pneumonia, or even problems with the neurological development of the children, those children are not going to school, but because they need to collect the wood, and they need to help on having access to these sources of energy. So we have a big opportunity here, but at the same time, a huge risk for the children in sub-Saharan Africa.
So Dr. Neira, what are some of the key recommendations by the World Health Organization to tackle this issue?
Well, we need to look at how our cities are developing now. Urban pollution is really a major problem, so a more sustainable transport system, a better planning by our mayors of how the cities are developing, access to clean sources of energy, a low carbon economy, and clearly bringing at the household level, bringing clean sources of fuels for cooking. I mean, we need to have access to rather electricity or more sustainable sources of energy, clean ones that will allow our children to grow in a very healthy condition.
So quickly before we wrap, Dr. Neira, what is the way forward?
Is to be aware that a healthy environment is good for our health, is good for the economy, and is good for development. Unless we protect the sources of safe water we have, we protect the quality of the air we breathe, even the quality of our oceans, and we reduce pollution, we will not be able to protect the health of our people.
Thank you, Dr. Neira. We thank you so much for joining us today.
Pleasure. Thank you.
And that was Dr. Neira. She's Director of Public Health, Environment and Social Determinants of Health with the World Health Organization.